Hi everyone, my name is Luis Gonzalez. Today I'm going to talk to you about the treatment of crossbites with clear aligners. But first, let me introduce myself. I got my graduate and master's degree in orthodontics in Universidad Europea de Madrid. Currently, I am medical director of Enlinea and ELIMS, two groups of orthodontic clinics where we treat all patients with aligners. I'm also founder of Smart Aligner Services, a company of treatment planning services in orthodontics. From my experience treating crossbites, whether we use braces or aligners, a proper diagnosis proves to be essential in successful treatments. For the diagnosis of crossbites, three basic aspects should be addressed. First one, volar ridge. The volar ridge is determined by mucogingival junction and it shows us the bone limits for expand the upper arch. Second, posterior torque. The more negative torque, the more we can expand, more chances of correcting the crossbite. If there is a zero or positive torque, then alveolar expansion will be limited. The third aspect is periodontal status. At this point, I look at the gingival biotype, if it's thick or thin, the alveolar bone level, and the presence of gingival recessions. Based on these three key points, we can determine properly our treatment plan. Ideally, if we find a deficit in maxillary development, we should place an appliance to expand upper bone. But in real life, not all adults are willing to undergo these treatments. Let's review a few cases for practicing our diagnosis. In the first picture, we can see a narrow maxillary bone, negative torque, and a thick biotype. If you notice, the upper right second molar serves as a guide to determine the quantity of expansion. This case is easier than we could expect, so we decided to treat it just with aligners and elastics. In the second one, there is a huge difference between maxillary and mandibular bone, and expansion is limited by zero torque and a thin biotype. So in this case, we place a MARPI appliance before starting aligners treatment to solve the bone discrepancy. In the next case, the upper bone width on the right side indicates that the first treatment option should be the placement of a MARPI. In the last one, the negative posterior torque and the thick biotype allow us to solve crossbite with aligners and elastics in an easy way. Once we understand the principles to determine the correct treatment plan, we can take a look to a few cases to explain in detail how we should plan them. Let's start off with a case of a unilateral crossbite in a 55-year-old patient who had been told that her case could only be solved with surgery. Although there is a skeletal discrepancy, as we saw before, the negative torque of the first quadrant will allow us to solve the crossbite easily. As we are going to maintain the position of the second and the third molars, these teeth will serve as anchorage. As soon as the upper teeth begin to cross the lower teeth, we tell the patient to wear the aligners while eating as well. With this instruction, together with 24-hour crossbite elastics, we ensure that chewing doesn't hinder the buccal movement of the teeth and that the periodontal state, especially for the lateral incisor, doesn't get worse. After a first phase of 24 aligners, this is the result we have. The crossbite is corrected, and in the next phase, we will expand the upper arch a little more and improve the occlusal contacts to finalize the case. This is the final result we get after 11 months of treatment. In addition to that, an action is required to prevent the relapse of the crossbite when the treatment ends. Consider that the patient has been chewing only on the right side for 55 years. This is a very strong habit. To achieve oral stability, function must be balanced. This means that the patient should start chewing on the left side. We will achieve this with occlusal adjustments, making the left functional masticatory angle smaller than the right one. In this way, the patient will start chewing on the left side as well. In the video, you can see how we reduce the left masticatory angle. Now it's easier for the patient to guide her mandible to the left side, because the effort it does to the left is less than to the right side. With these adjustments and some practice, the function will be well balanced. In the following case, the patient has a unilateral crossbite but with a functional deviation. We cannot plan this case in maximum intercruspation. We should treat it in centric relation. Our goal is, in addition to correct the crossbite, to prevent mandibular deviation to the right and associated joint problems. Here you can see the assembly of the models in centric relation. To do this, we scan the patient in that position and then ask the technician to use that bite registration. For those of you who don't have a scanner, don't worry, you can use a wax record in centric relation and send it together with the silicone impressions. Note that by bringing the patient into centric relation, the crossbite practically disappears. Now we have a different case in which there is an edge-to-edge relationship in both posterior sectors. As the torque of the upper teeth is good, we plan crossbite correction by means of lower compression, assuming that crossbite elastics will slightly expand the upper arch. In this case, we use 6 ounces crossbite elastics, 24 hours on the right side and 12 hours on the left. After finishing the first phase with 26 aligners, we have corrected the functional deviation of the patient and the crossbite. The patient was positively surprised on how his bite had improved, and most importantly for him, how quickly it had changed. With 36 aligners in 9 months, the treatment is finished. We also made the occlusal adjustments for get a balanced functional occlusion, as in the previous case. This type of adjustments, together with night retainers, are very useful to enhance the stability of the treatment. Here, you can see how we keep smile aesthetics with a good posterior torque control. Remember that, in orthodontics, protocols are just the basis, but you should remind to adapt them to each patient in order to get a successful treatment. Now let's summarize these protocols in 4 simple keys. Plan an additional buccal root torque in the upper teeth to compensate the flaring effect of the elastics and maintain a correct posterior torque. Solve the crossbite more by lower compression than by upper expansion. As the elastics are already going to expand the upper arch, we use the upper aligner as anchorage. We don't want to move the teeth out of the cortex. I recommend to over-engineer lower compression for improved predictability. Place occlusal bevel horizontal attachments on teeth that are in crossbite to improve root control. Control the use of elastics 12 hours or 24 depending on how the crossbite is resolved. Elastics are the most important tool to solve these cases, and we have to explain their importance to patients so that they collaborate properly. So with these conclusions, this video about crossbites is finished. I can just say that working with aligners is one of the best changes I have made. Also, the more you work with them, the faster you learn. I encourage all of you to try it, don't be afraid. Orthodontic principles are always the same. I hope that all of you enjoyed this video, and if you have any questions, you can ask it through my Instagram, SmartAligner. Goodbye.